This is me, the psychotherapist again. This is on, I think, anxiety and PTSD. A little bit of anxiety, a little bit of PTSD, some advice. Well, anxiety, comes to us all from time to time. It comes to us all, we just, some social interactions, a fear, a thought, just, you could go years without a panic attack. You go days, months. All of a sudden, just something makes you just trip out. Something makes you freak out. Something triggers your brain, your mind. It gets you scared. It gets you scared, and you just bug the fuck out. But I mean, there's no reason to be hiding and sitting at home all day. I mean, you can come out and be free. It's perfectly normal. Most people suffer from anxiety. You get anxiety anytime, any day, any place, anywhere. You could be in a fucking professional lecture and a public speak, and you could, have a panic attack and just bug the fuck out and look crazy to the front of the people. An anxiety attack could happen anywhere. Uh, Besides anxiety attacks, if you get it very frequent, it's a disorder. If every day you're panicking, every moment, every hour, if you're panicking for every little bullshit, you step out the house and you panic, you hit the corner store and you panic, you're at the dumpster throwing away the trash, you're panicking, everything makes you panic. It's because you suffer from a disorder. It's a disorder, and it's not just a normal mild anxiety attack that just came out of nowhere. And these disorders just come from fears, phobias that come out of nowhere that trigger just from an experience or anything in life. Some things that could give you anxiety that could also how do you say enhance the anxiety, fears, and phobias is drug use, like marijuana. Marijuana, it's built on hallucinations and phobias, and develops phobias and paranoia. And you're smoking that marijuana all day, every day, every week. And that's what gives you anxiety. When you're sober, you have your phobias from being high, and your paranoia from being high. And when you sober up, you believe it to be true and real, and you're just scared to step outside the house. You don't want to go to the store. You're scared at the stores. You're like a little turtle in a little shell, and you don't want to come out to play with people, because everything scares you, everything gets you fearful. The devil's alive and large in front of your face, hallucinating, and you're very scared. That's because of the marijuana use. Sometimes anxiety is not a disorder; it can be because of marijuana use. But if you find yourself, not smoking marijuana and still having anxiety attacks, then it's a disorder. It could be, the disorder. It's not mainly a disorder because you could be from drug use, smoking marijuana, or whatever it is. And if you don't have none of those, just know that anxiety is, it's normal for everybody. Everybody catches it. Anybody, from the biggest dog to the smallest chihuahua, they all catch anxiety. Everybody catches anxiety, and from the most thorough dog to the most biggest mutt, everybody catches anxiety. It don't make you less competent, less weak, less bright, less brilliant, less powerful, less successful. Everybody gets a panic attack from time to time. Everybody's panic sick. It could come at the worst time. It could come at the best time. Just do what you got to do to catch your breath, and set aside, and pay, try to pay, get excuses from what you're doing, and try to just relax yourself. Think clear, happy thoughts. Clear your mind out. Focus on breathing and taking a breath of fresh air, and just try to relax yourself until the anxiety passes and it's no longer there. Besides anxiety, now PTSD, post-traumatic stress. uh, Post-traumatic stress is just pretty much just something that triggered an anxiety attack, the phobia from an incident. You could be in the battlefield, and a grenade blew up in front of you and it shocked you, and it's scared. And the thing about post traumatic stress is just it's an occurring event. It's like an anxiety attack, but it's built in your subconscious, and it comes out of nowhere at any time where you're sleeping, or you're in the traffic, and something triggers the memory, and it comes out and it just shocks you and it spooks you, and you feel like you're living it again, and you're just reliving the reality of the shocking event that you lived. Uh, Me personally, I have PTSD as a neighbor. I was attacked by bad neighbors, and I just wake up shocking and breathing in my bedroom, fearing the attack of my neighbors trying to hurt me and harm me. While I wake up, sometimes I might stomp the ground, try to ward off the predator or whatever. But I try to control that. I try to catch my breath. I try to get over that. But different people suffer from different traumatic stress. It could be anything from a car accident, where you just panic in the road and you just pump on your brakes and you cause a collision or something and you don't want to get in a car wreck. I think they have medications for that. They have treatment for that. Anybody can get it. It doesn't make you a weak man. You can be a strong warrior and still catch PTSD. You can be a brave man. It doesn't make you a coward because you're scared or you're fearful. Anybody can catch PTSD. Anybody can catch PTSD, and it's life changing. It is life changing because it's a fear, or phobia you have in your mind from a shocking event that you don't want to, that's very traumatic. You don't want to relive it, and it's just in your head and your mind, and it comes to surface at the worstest time. Something triggers the event, and it's just out there in the open, and you're just panicking in public, and it goes on in your life, and you just try to get over that in the way possible. My suggestion is to take the treatments, meds, and whatever the doctor prescribes you, psychiatrist, and learn how to fight anxiety. Take some breathing exercises, some breathing classes, some meditation, and try to somehow combat your fear and phobia, and face it dead on, and maybe you can get over the anxiety and overcome that traumatic stress that you have. Thank you.